Hello, guys. Welcome to my YouTube channel. Today, I'll be dealing with a very important topic: hepatitis B, the silent killer. Five things everyone must know before it is too late. So, why is hepatitis B called the silent killer? It's called the silent killer because people can harbor the hepatitis B virus without them knowing. There are many otherwise healthy looking individuals who carry the hepatitis B virus without knowing why the virus is quietly damaging their liver. The virus can remain in the body for 10 to 30 years without showing any signs or symptoms. That is, the person has no pain, no warning sign, nothing to suggest that the person is carrying the virus. So this is what makes hepatitis B particularly dangerous. The fact that it can remain in the body for so many years while quietly damaging the liver. So globally, it is responsible for about 1 million deaths annually. So it has been a significant it's a source of public health concern because it's responsible for about 1 million deaths yearly all around the world. So the good thing about hepatitis B is that it can be prevented. It can be prevented. There's a vaccine for hepatitis B. So in this video, we'll be looking at hepatitis B, the damages it can cause. So the question I have for you is: have you checked your hepatitis B status? When last did you check your hepatitis B status? So, what is hepatitis B? Hepatitis B is a viral infection that attacks the liver. It attacks the liver, causing inflammation and damage to the liver. So, but before we proceed, I would like us to look at the various functions of the liver. The liver is a very important organ in the body without which we cannot survive. So, what are the various functions of the liver? We have number one, the liver detoxifies the bloodstream. That does it detoxifies the body. It helps to eliminate waste product. That's what I'm trying to say. Number one, the liver helps to eliminate waste products in the body. The various waste products in the body that are being carried by the bloodstream is filtered through the liver. So that is how the liver works to cleanse your blood of toxins to by eliminating the waste product. Another thing is that the liver, number two, rather, is the liver produces important substances that are necessary for the healthy functioning of your body. Substances such as proteins. They are important proteins that are necessary to fight infection, that are important to carry important substances from one part of the body to the other. The liver produces these important proteins. Also, hormones that help to send signal from one part of the body or the other. The liver produces them. So that is the second thing the liver does. The third thing the liver does is that it helps to metabolize drugs. When you take a medication, the liver converts that medication to active substances that helps to heal or cure diseases. So that's one function of the liver. When you take alcohol, it is the liver that metabolizes the alcohol as well. So the third thing is the liver stores nutrients like vitamins and minerals. The liver stores them. The fourth thing is that the liver controls your blood sugar. When you finish eating after a meal, the liver stores the excess sugar in form of glycogen. And when there's no food or when there's starvation, the liver will slowly release this sugar into the bloodstream. So, and the last thing I want to talk about in the function of the liver, I think it should be the fifth or sixth, I can't remember, now, is that the liver helps to fight infection. The important substances that are secreted by the liver that helps to fight infection. There's also the cells like the macrophages that helps to fight infection. So those are the functions of the liver. When the liver is attacked by hepatitis B virus, there's damage to the liver, and the liver will be unable to carry its function. So let's look at hepatitis B and HIV. What are their differences and what are their similarities? One thing I want you to know is that hepatitis B virus is more infectious than HIV. In fact, hepatitis B virus is 50 to 100 times more infectious than the HIV virus. And that's because hepatitis B virus is easier to transmit. A little quantity of blood can transmit the hepatitis B virus, whereas HIV needs a much more uh, greater quantity of blood or body fluid to transmit it. So you have to note that the hepatitis B virus is more infectious. Second thing to note about the hepatitis B virus is that it survives longer outside the body compared to HIV. When the HIV virus is outside the body, it lasts only a few minutes before it becomes inactive. Whereas the hepatitis B virus can be outside the body for more than 7 days. Let's say somebody who has hepatitis B spills his blood on a surface. That surface can still be infectious after 7 days. That means somebody that comes in contact with the hepatitis, that surface can still catch the hepatitis B virus even after 7 days. Whereas for HIV, it is just a few minutes before the virus becomes inactive. That's to tell you that the hepatitis B virus is a hard virus, it's a hardened virus, it's a durable virus compared to uh, the HIV. So another thing you have to know is that hepatitis B kills more people than HIV yearly. There are more people that die from hepatitis B infection than from HIV yearly. Hepatitis B virus has a vaccine that is can be prevented by vaccine. That's the good thing. The hepatitis B virus has a vaccine which has been there for years. So it is important you take advantage of this vaccine to prevent hepatitis B infection. So whereas it is just only recently we started hearing about a vaccine for HIV that can prevent HIV infection for like 6 months. So that is the good thing about hepatitis B. It has a vaccine. So, despite this, I want you to know that both hepatitis B and HIV can be managed. So, in the case where somebody has the hepatitis B virus, it can be managed and the person can live a long and healthy life like any other person. So we move to how hepatitis B spread. What are the various ways by which somebody can contact or by which hepatitis B can be transmitted? Number one, we have mother to child transmission. The mother that is infected with hepatitis B can transmit the virus to the baby at the point of delivery. So this is the common route of transmission, the mother to child transmission. So many people are born from birth. They have from birth with the hepatitis B virus. The second way is through unprotected sexual intercourse. The virus can be found in body fluids like the vaginal fluid, in semen, in blood. So during unprotected sexual intercourse, they can be exchange of body fluid, and somebody that is uninfected, that is an uninfected partner, can contact the virus. This third way by which somebody can get hepatitis B virus is through direct contact with infected blood. For those who share sharp objects like needles and syringe, like intravenous drug users, people who inject themselves with heroin and other hard drugs, they might share needles, and somebody infected with hepatitis B can transmit it to someone who does not have the hepatitis B infection. Now, also for people who do tattoos, an unsterilized sharp object used to make tattoos can also transmit the virus from somebody who is infected to someone that is not infected. Then we have in healthcare workers, and the healthcare workers are usually advised to be vaccinated against hepatitis B because they can be predisposed to what we call accidental needle stick injury. That is in the process of a nurse giving, let's say, an injection medication to a patient that is infected, he or she can accidentally injure himself, and you know that the hepatitis B virus is very infectious. So a little quantity of blood can transmit that hepatitis B virus to an uninfected healthcare worker. So then the last one I want to talk about is on-screen blood transfusion. So somebody can have shortage of blood and the person is in need of blood transfusion. When that blood is not screened of hepatitis B, it can directly contact hepatitis B infection. So we have talked about the various ways by which somebody can be infected with hepatitis B infection. So let's look at the various ways by which somebody cannot catch the hepatitis B virus infection. That is how hepatitis B is not spread. So I want you to know that hepatitis B is not spread by casual contact. That is, if you shake somebody who is infected with hepatitis B, you are not going to catch the hepatitis B virus. If you hug somebody who has hepatitis B infection, you are not going to catch it. If you give a kiss let's say on the cheek to somebody who has hepatitis B infection, you are not going to get it. So if you share toilet with somebody who has hepatitis B, you are not going to get it. If you share swimming pool with somebody who has hepatitis B, you are not going to get the hepatitis B virus. Now, this is important to eliminate unnecessary fear and stigma that surrounds the hepatitis B infection. So we proceed to another aspect of this topic. So the silent danger of hepatitis B is that it can remain in the body, like I earlier said, and quietly damage the liver over several years. Let's say 10 to 30 years, the person can carry the virus and the virus is quietly doing damage. I had an unfortunate story of a classmate. We started medical school together. Then all of a sudden, over the holiday, I heard that he was hospitalized, and from there he passed on. This is somebody who got a scholarship to study medicine, and he died. And what was responsible was hepatitis B virus infection. The virus had been in his bloodstream as a medical student, quietly damaging his liver until he finally gave up. So this is very important. So hepatitis B can cause what we call cirrhosis. Cirrhosis means scars. If you have ever had an injury before, or you know somebody who has a serious injury, you find out that the person, the wound will heal, but there will be a scar, and that scar can cause a disfigurement depending on the degree of the injury. So that's the same thing that happens in the case of a liver cirrhosis. The virus attacks the liver, causes injury to the liver, and what happens is that eventually there's healing, but that healing is not without scars. So the more there's the scar in the liver, the less effective the liver will be in carrying out its function. So another thing the hepatitis B can do is it can directly cause cancer. HIV cannot directly cause cancer. That's something I forgot to mention earlier. HIV does not directly cause cancer, but hepatitis B can directly cause a cancer, and that cancer is called liver cancer. Liver cancer. Hepatitis B can cause liver cancer. The third thing hepatitis B can do is to cause liver failure. Liver failure, that means the liver completely fails, and without the liver, a person cannot survive. So, in the case of liver failure, it can lead to death if there's something not done, like the liver transplant. So, we want to talk about the stages of hepatitis B infection. And I want you to know something, that there are two stages to the hepatitis B infection. We have the acute hepatitis B infection, and then we have the chronic hepatitis B infection. Now, the acute hepatitis B infection usually happens within 1 to 6 months of a person coming in contact with the virus. Let's say somebody is infected with the hepatitis B virus. Within 1 to 6 months is the, will I say, the golden phase, the Goldilocks stage. That means it's a stage that decides whether the person will carry the virus for life or whether the person will eventually be free from the virus. So let's say a person is infected with the virus, maybe through direct contact with infected blood, through unprotected sexual intercourse, or through a blood transfusion. The virus will enter the person's bloodstream. Then the immune system, that is the system that is in the body responsible for fighting invaders or foreign bodies, will mount their own response. If the body is successful, the body will completely clear the infection and the person will become negative. So in acute hepatitis B infection, the person comes in contact with the virus. The surface antigen is what is used to test for whether somebody has hepatitis B or not. So if the surface antigen, usually shortened as HBsAg, if it is positive, it means the person has hepatitis B, a current infection. But if after 6 months the person the surface antigen becomes negative, it means that the body was able to successfully clear the infection. So, in about 80% of people, once they come in contact with the virus, even without the vaccine, the body is able to clear the infection, and the surface antigen moves from positive back to the original negative. But in about 20% of people, the hepatitis B infection will progress to the chronic hepatitis B infection. Now, in this chronic hepatitis B, means that the surface antigen will remain positive for life, meaning that the person will carry that virus for the rest of his life. And this is where the problem is, because as as much as the person carries the virus, is as much damage that will be done to the liver. So let's move to the hepatitis B, the chronic hepatitis B infection. That means the virus persists long term and for life in the person's system. And that means eventually they can lead to the three complications I earlier mentioned, which is liver cirrhosis, liver cancer, and liver failure. So, how do we test for hepatitis B? I already mentioned one, which is called the surface antigen. The surface antigen, like I earlier mentioned, is shortened as HBsAg. So, when you see it on a test result, HBsAg, that's surface antigen. It's called surface antigen because it is found on the surface of the virus. It's a protein that is found on the surface of the virus and can be used to detect the virus. But there are other antigens which I'm going to mention, but the most important ones for testing for hepatitis B is the surface antigen. So, what are the other antigen? We have the core antigen, which is shortened as HBsAg. Now, this core antigen is found inside the virus, So, it is not directly it's not something that can be directly measured, like the surface antigen that is on the surface of the virus. It's inside the virus. That's why it's called core antigen. So then we have the third antigen called the E antigen. Now, the E antigen is usually secreted by infected liver cells. When the virus attacks the liver, that means the liver cells is attacked. It secretes this protein called the E antigen, shortened as HBeAg. So when you see HBeAg on a test result, you know that they are talking about the E antigen. And the E antigen shows how active the virus is. So once the E antigen is detectable, it shows that the virus is highly effective, highly infectious, and is actively replicating, actively multiplying. So E antigen it shows the activity of the virus, how active the virus is. So then I want to talk about the hepatitis B panel. The surface antigen only gives you partial information. Yes, it's an important information because it shows whether the person has hepatitis B or not. That is, the person has a current infection. That's the surface antigen. But the hepatitis B panel is a test that is like a combo test that gives you more complete information compared to just using that strip they use to check for the surface antigen. So, what are the things the hepatitis B panel can show you? It can show that the surface antigen is positive. It can also show the antibody. Antibody is the substance that the body produces against the antigen. It's just like a soldier that is sent to fight a terrorist or a bandit. Okay, so when the virus enters the body will detect the surface antigen of the virus and send out antibodies. So the hepatitis B panel can detect the antibody. So when there's antibody to the surface antigen, it indicates immunity. Now, for people that have the vaccine, that has taken the complete vaccine for hepatitis B, they will have positive anti HBs, that is positive antibody to surface antigen. They will have it, but the difference is that their surface antigen will be negative because they are not infected. It's just the antibody that they got from the vaccine. Okay, so then we also have antibody to the core antigen. I already told you that the core antigen is found within inside the virus and is not directly detectable, but the body can mount an immune response, and send antibodies against that the core antigen. This is called antibody to the core antigen. So it usually shows past exposure to the virus. So when you see if antibody to the core antigen is positive, it indicates past exposure to the virus. So I really did justice to explain the various things, information that can be gleaned from the hepatitis B panel. So what will happen if your surface antigen is positive? So if your surface antigen is positive, it indicates that you have a current hepatitis B infection. And if after 6 months it's still positive, it shows that you have a chronic hepatitis B infection. So in a case where somebody has hepatitis surface antigen is positive, further tests are necessary. But if it is negative, it means you can go for the vaccination. Okay? So, what are the further tests that are necessary for somebody that has a positive surface antigen? We have number one, viral load. The viral load tells you the number of virus, hepatitis B virus, you have in your blood stream. So, if you do a viral load and it's less than 2,000 international units per mil, that means you have less than 2,000 viruses, hepatitis B viruses in your bloodstream. It means you have a low viral load. But if you have something like greater than 20,000 international unit per mil, it means you have a high viral load and means more damage will be done to your liver. So low viral load means less than 22,000, sorry, less than 2,000 copies of the virus, more than 20,000 copies of the virus or international unit per mil, that's the unit, shows that you have a high viral load. So anywhere between 2,000 to and above, sometimes due to as a result of other criteria, treatment is started. So we'll go into that. So what is the second test that can be done for somebody who has this positive surface antigen? We have the liver enzyme. Now, when you say you have a balloon that is filled with water and somebody comes to puncture that balloon, what happens? The water in the balloon leaks out. So it's the same thing. The liver has what we call enzymes. Those are substances that leak out when the hepatitis B virus attacks the liver. So when there's an attack to the liver, the virus will leak out this enzyme. And what are these enzymes? We have the most important one, which is called the ALT enzyme. So in case you see it on a hepatitis B panel reports, you see something like or maybe you see it in a LFT, usually yes, liver function test. You see ALT. You know, you are talking about a liver enzyme that shows the level of damage that is being done to the liver. So this ALT stands for alanine aminotransferase, ALT. So it's specific to the liver. So the more the ALT rises, the more damage is being done to the liver. So the more ALT rises, it shows that more damage is being done to the liver. So and there are cutoff values that are used to show if damage is being done to the liver. For example, if ALT is greater than 30 international units per liter in men, it shows that there's high level of damage to the liver. But for women, if ALT is greater than 19 international units per liter, it shows that more damage is being done to the liver of the woman. So you should just take note of this. So then we have AST. AST shows liver damage, but it's not as specific as the ALT because there are other organs in the body that also have AST. So AST is aspartate aminotransferase, but the ALT is more favored to show liver damage than AST. Then what is the third test that is done in somebody that tests positive for the surface antigen? We have the FibroScan. Now, I told you about scars being formed in the liver. So this FibroScan shows how stiff the liver is. If the liver is stiff, very stiff, the degree of stiffness, how stiff the liver is what the FibroScan measures. So the more scars are being formed in the liver, the less elastic it is, the more stiffer it becomes. So once the FibroScan measures the liver and shows the amount of stiffness, it also indicates the level of damage that's been done. There's a value for it, I think it's 400 kilopascal. So it's measured in kilopascal. So the more the stiffness, the more the damage that is being done to the liver. So I hope you get that. So we'll now talk about when do we start treatment. So the fact that you test positive for hepatitis B does not mean you start treatment immediately. There are certain criteria that we look at before we start treating somebody that has chronic hepatitis B infection. So, in this case, we're talking about chronic, meaning the person is carrying the virus for life. So, when do we start treatment in chronic hepatitis B infection? Number one, when the viral load is high. I told you when you have something like greater than 20,000 international units per mil, that is more than 20,000 copies, it means you have a very high viral load. And it means that there's a potential for liver cancer to happen and for liver failure and more damage to be done to the liver. So a very high viral load is an indication to start treatment immediately. But for somebody that has a low viral load, let's say less than 2,000 copies of the virus, we usually say, okay, let us monitor. We keep monitoring periodically to see whether the virus will multiply so much. Maybe we'll say, okay, let's monitor every 6 to 12 months. So, but in a high viral load, it's an indication to start treatment immediately. Another one is if the liver enzyme is highly elevated. I mentioned the ALT and the AST. So, if you have greater than 30 for men, greater than 19 for women, it's usually an indication to start treatment immediately. We have, if there's evidence of cirrhosis, that means there are scars, too many scars forming in the liver. It shows that the liver is severely damaged and it's an indication to start treatment immediately. Then, very important is if the person has a family history of liver cancer. The family history of liver cancer is an indication to start treatment immediately. And then the final one is if the person has co-infection. So somebody can have hepatitis B and also be infected with HIV. So the fact that you have hepatitis B does not mean that you should be reckless, because somebody that have hepatitis B can also get HIV. So in such a case, the person is co-infected with HIV. In such a case, the damage that is going to be done to the body will be more. So usually advised that when somebody has co-infection, the person should start treatment immediately. Somebody can have hepatitis B and also have hepatitis C, which is another virus that attacks the liver. So if the person is co-infected, we say start treatment immediately. Then there's one virus I would like to talk about, which is called the hepatitis D virus. Hepatitis D virus. This hepatitis D virus needs hepatitis B before it can infect somebody. So somebody that has hepatitis B can be infected with hepatitis D. That's because hepatitis D is an incomplete virus. It needs hepatitis B to infect somebody. So somebody that has hepatitis B is at risk of getting hepatitis D, which will multiply the damage being done to the liver. So how do we treat hepatitis B? That is, how do we treat chronic hepatitis B infection? I want you to know that in this instance, it is not to cure, because now the person is going to harbor the virus for life. What we do, the goal of treatment is to suppress the virus so that it doesn't multiply. So that is the goal of treatment in chronic hepatitis B. And there are drugs that are used in these instances. We have drugs such as tenofovir, we have entecavir, and then we have lamivudine. These drugs are usually prescribed when these criteria I earlier mentioned are met. So in this case, the person takes the drug once daily. So once the person takes the drug once daily, the person is fine, because the drug will suppress the virus, and if the virus is sufficiently suppressed, the damage to the liver will not occur. And so the person can live a long, healthy, normal life like any other person. So it's important that if you have chronic hepatitis B infection, that you adhere to your treatment as prescribed by the doctor. So prevention is power. Prevention is power. So we have talked about the various ways by which hepatitis B can be transmitted. So if you get tested for hepatitis B and it's negative, what is recommended is that you can proceed for the vaccine. The vaccine, I think, is given for the 3 or 4 doses. I can't remember right now, but if your surface antigen is negative, it is recommended that you go and get vaccinated. And this vaccine, once you take it, like three doses, I think I got 3 doses when I had mine, you are protected for life. The vaccination covers you for life, meaning you cannot be infected once you are vaccinated. So, and if somebody has a positive surface antigen, the person is not a candidate for vaccination. In this case, it goes for further evaluation, like I mentioned, then treatment. So, having said all this, I want to ask you a question. What are you going to do with all that you have learned, all the information I've given out in this video? What are you going to do with this information? One thing I want you to do is that go and know your status. Go and get tested. It's a simple test, a very cheap test. They'll use a strip to check whether you have to check your status. Then, if it is negative, you get your vaccine. If you are positive, you go further for evaluation and liver enzyme. So you can protect yourself and your family by avoiding unprotected sexual intercourse, avoid sharing sharp objects, avoid on-screen blood transfusion. So I want you to share this video with as many people as possible. There will be somebody who is in need of this information that you have just heard. And I want you to like this video, subscribe to this channel, and I want you to ask your question in the comment section. I'll be ready to answer your question. So this is all I have for you today. Till I come your way again next time. See you.